If you encounter a pathogen or an invader, your skin provides an extraordinarily effective barrier. The many stratified layers, the waterproofing from keratin, and the tight junctions of the keratinocytes and the stratum spinosum of the epidermis all act to prevent entry. The skin also secretes substances known as the acid mantle. Your acid mantle can contain, among other things, IgAs, A immunoglobulins, and dermcidin, which is one of many antibiotic proteins that can denature proteins in the cell membrane of invaders. However, using harsh soaps can actually wash away your acid mantle, reducing its effectiveness. But these physical barriers, they form the first line of defense, preventing entry into the body to begin with. Additionally, respiratory cells in areas like your trachea have cilia and a mucus layer that's designed to trap and expel foreign particles. Again, A-type immunoglobulins are found in the mucus of the four mucous membranes of the body: the respiratory, digestive, reproductive, and urinary membranes. In this diagram of a mucous membrane, these dendritic cells over here on the left are drinking fluids and they ingest a pathogen. And so the dendritic cell, it travels to this lymph node here in the center and it says, hey, I found this. I don't know what it is, but I thought that someone would like to know. And a B cell that's living in the lymph node will say, oh, yeah, that's bad. And then the B cell differentiates into a plasma cell that secretes more of those A-type immunoglobulins into the mucus layer. And these A-type immunoglobulins, along with other antimicrobial proteins, are capable of pretty much neutralizing the bacteria in the inner mucus layer before they even get through the epithelial cells that are guarding the inside of the body. Ugh. Talking about fevers is like personal punishment in this class. Fevers are they're kind of genius actually. It's kind of a genius response of the body based on a very simple fact. Raising your temperature even 1 degree makes you inhospitable to so many different bacteria. I don't know about you, but I feel like I'm dying when I have a fever. I had a student once who said when she has a fever, she feels like writing up her will. I was like, yes, yes. So I bet that little tiny bacteria really hate it when even there's a 1 degree increase. I mean, I do. What sparks a fever in the first place are proteins that are called pyrogens that are secreted by white blood cells. They find a pathogen or an invader and they're like, whoa, I don't know what this is. And they start to secrete these pyrogens. And pyrogens, they circulate to the hypothalamus. And they say to the hypothalamus, hey, there's something in the body that we're having trouble eradicating. Could you just raise the basal body temperature a little bit? And a fever, at first, it starts out like positive feedback. And this is what is called onset, where the fever is progressively getting worse and worse and worse as time goes on. However, there's kind of like a plateauing of it, which is this phase of a fever that is called the stadium phase. So this is onset. This is stadium right here, right? And you don't really just hold a body temperature at stadium. You kind of like fluctuate around it as your body tries to regulate for homeostasis. At some point, though, your white blood cells really start to overcome that invader, and your hypothalamus stops getting so many of those pyrogens floating around. And your body temperature starts to lower again. And this is what is called defervescence. So, this is why this is like a personal thing for me. After my first back surgery, I ran a fever for 2.5 years. It was awful. I went through onset every morning, stadium throughout the day, and defervescence only when I came home at night and relaxed. Actually, fever of unknown origin, or FUO, it's more common than you'd think. FUO, or fever of unknown origin, it can have four origins: cancer related, autoimmune issue related. There are such autoimmune diseases as Mediterranean fever. You can also be infectious disease related. And then my last and favorite category of the acknowledged fourth category of fever of unknown origin is unknown. It's just great. So I found a lot of statistics saying that people in the unknown category, like myself, they usually just stop obtaining medical assistance out of frustration. And that's certainly what I did for a while until I started to pursue some people that gave me better health care, not only to deal with the fever, but to try to find what it was. Because you know what? You shouldn't be running a fever every day for 2.5 years. At least that's my personal opinion. Okay, so let's say a pathogen enters, right? Inflammation is a genius innate response. If a pathogen breaches the skin, like through a cut, damaged tissue releases alarm signals called cytokines, and these initiate inflammation. Inflammation is beneficial. It prevents the spread of damaging agents, it disposes debris and pieces of the pathogen, and it prepares tissue to begin repairing itself. So, inflammation acts as both a quarantine and a sanitation mechanism. For instance, in our peanut allergy case study, corticosteroids suppress inflammation post surgery, providing patients with a reduction of pain. But the reduction of inflammation can also reduce the body's ability to respond to pathogens. There are three cardinal signs of inflammation: redness, swelling, and heat. Some people also use impairment as a sign of inflammation. These are all signs because a medical professional would be able to confirm them on the patient. There is one symptom associated with inflammation, which is pain. Pain, as with all symptoms, has to be reported by the patient and can't be visually or otherwise confirmed by a medical professional. All of these signs, they all occur from the vasodilation of blood vessels in the damaged area. This vasodilation is allowing excess fluids and cells to seep from the blood vessels into the damaged area so that the leukocytes and other cells can start their repair and cleanup. The excess fluids, though, they cause that swelling, and the activity of the white blood cells causes that heat, and the vasodilation of the blood capillaries causes the redness. Inflammation is not only about gobbling up the pathogen, although that is the that is the main thing. Inflammation is also about initiating that process of tissue repair once the pathogen is cleared. And this is why some leukocytes, they secrete growth factors when they're done or when they don't sense any more pathogen. So inflammation, it begins with a warning siren made up of chemicals secreted by the injured tissues. The chemicals, they act as a homing beacon for macrophages and mast cells to migrate to the injury site. So macrophages start engulfing bacteria and debris, and the mast cells start secreting histamine. Histamine is a very potent inflammatory chemical that causes symptoms we associate with allergies like a runny nose, hives, watery eyes, swollen tracheas. Histamine causes the surrounding arterioles to dilate, and this brings that warm blood to the area. It increases the local temperature. Local macrophages, they also secrete cytokines when they encounter a pathogen. These cytokines enter into the bloodstream and they recruit other leukocytes to exit the bloodstream and enter the area. The histamine increases the permeability of the local capillaries to promote exudation or the leaking of capillary fluid into the tissues. This leakage carries antibodies and clotting factors with it. And so the dilated capillary allows these neutrophils and these monocytes in the blood to exit a blood vessel and enter into the damaged tissue. This is what causes the swelling. And the swelling, in turn, presses on nerves, causing pain. If the injury is very badly infected, pus can develop. And this creamy, yellowy substance is a mixture of dead white blood cells, ruined tissue, and living and dead pathogens. If the area is very badly infected, it can be walled off from the rest of the body by scar tissue. And this scar tissue is made from collagen fibers, and it can eventually form an abscess. At this point, the pus and the fluid buildup within the abscess have to be drained before the injured area can heal properly.